Hi everybody, in this video we're going to be going over a nearly normal CT exam of the head. This is a case of head trauma, and so the question is there intracranial bleed or any kind of serious trauma that the patient and the physician need to be aware of? So the first thing I do is I'm going to quickly take a look through the exam to look for any obvious abnormality, and nothing pops up on the first scan through. Then I'm gonna look for any blood, and blood can have different appearances depending on the age of the blood, but usually in an acute setting like this it's going to be hyperdense or bright. So first I'm going to look along the right side of the brain, and I don't see anything. I'm going to look along the left side of the brain, and I also don't see anything. We'll look in the infratentorial compartment where the cerebellum is, and I don't see anything there. Now, I've already looked for blood, but I've also kind of evaluated for any kind of obvious mass or any kind of midline shift or abnormal mass effect, and there isn't anything here. Next, I'm going to look for any abnormal collections or fluid collections between the brain and the bone in this space called the extraaxial space. That's usually where cerebrospinal fluid is. So I'm looking along the convexities of the brain for any kind of abnormal extraaxial collection. There is nothing on the right. I'm looking along the left side now, and nothing there either. We're going to look along the falx cerebri as well. This is another place that extraaxial collections can be. And at the same time, I'm also going to be evaluating the density of the larger dural venous sinuses. This is the superior sagittal sinus. We don't want to miss any kind of dural venous sinus thrombosis. So nothing along the falx. We're going to continue looking at the dural venous sinuses, and we're going to look along the transverse dural venous sinuses and the sigmoid dural venous sinuses, and there's no abnormal density to suggest any significant pathology. So far everything is negative. Next, I'm going to look at the gray-white matter junctions. You can see that there's some darker or hypodense tissue here, and some brighter or hyperdense tissue here. This is the cortex, and this is the subcortical white matter. You can look for a few things when you're evaluating this. The main things would be for a stroke, and also in traumatic cases you can look for evidence of a specific type of injury known as diffuse axonal injury. And so here we're looking along the gray-white matter junctions, evaluating the basal ganglia as well. Here you can see the caudate, your putamen, your globus pallidus, and your thalamus. And I can see all of them well. Looking on the left, and again, I see a nice gray-white junction along the convexity of the left cerebrum, and then also medially, and then posteriorly along the parietal and occipital lobes, and again the basal ganglia, caudate, putamen, globus pallidus, and thalamus. And you don't want to miss the insula here, which is a little ribbon of cortex. It's important for middle cerebral artery strokes. We'll also look at the cerebellum to see if it has normal gray-white differentiation. And lastly, we'll look at the brainstem, and everything looks normal. Next structures we're going to evaluate is the white matter generally, looking for any kind of white matter disease, and this is a younger patient, so we expect it to be relatively clean, and there's no obvious subcortical white matter disease on this exam. We'll look at the ventricles. Start off with the lateral ventricles. These are normal in size, normal in configuration. Here is the third ventricle, foramen of Monro. coming down into the fourth ventricle over here, we have our normal basal cisterns, this star shape. These are our basal cisterns, and there's no blood in them, and they are patent. Lastly, we'll look at our vascular structures. It's a little difficult to evaluate on a non-contrast enhanced exam, but we can get a rough look at them. So here are your vertebral arteries, and they're going to join to become a basilar artery, which is not well seen here. Here we can see the basilar artery. Look for any kind of aneurysm or abnormal enlargement of the vessel. And then in this location, you'll typically see your middle cerebral arteries. In this specific case, we don't see them well. Your internal carotid arteries are present here in your cavernous sinus. And then the pituitary gland, which appears normal. So far everything is looking good. We're going to switch to the soft tissue window. Oops, here we go. And evaluate the scalp. And so posteriorly, the scalp appears normal. On the right, we have a little bit of increased soft tissue or soft tissue induration. It's probably a little bit of blood, a little small scalp hematoma, and we can see just a little bit of air. Just a little bit of air here, so this is probably a small laceration with underlying frontal scalp hematoma. Evaluate the rest of the scalp, and then on the left, and the rest of the scalp appears normal. We'll take a look at the globes and the orbits, and we see here as far as we can see, the globes are normal in morphology. They have normal shape, and we can just barely see the lenses here, and there's no obvious evidence of lens dislocation. And the extraocular muscles that we can see also appear normal. And then lastly, we're going to switch over to bone window and look for any kind of fractures. So posteriorly, the calvarium appears intact. Along the right, along the front, and along the left, the calvarium appears intact. We'll evaluate the paranasal sinuses in the acute traumatic setting. Sometimes you can catch an air fluid level, which can indicate fracture with blood in the sinus. And so we have the frontal sinuses, your ethmoid sinuses, your sphenoid sinuses, and here we can only minimally visualize them, but these are your maxillary sinuses. We can also partially see the mastoid air cells and the tympanic cavities, and these are normal. They are filled with air. On the right, it's normal. On the left, also normal. We can see the external auditory canals and the temporal bone with the internal auditory canals. Everything looks normal. Lastly, we're going to evaluate the skull base, and this can be a little daunting at first, but after you've seen this a number of times, it's not too bad. You can see the temporomandibular joints. You can see the foramen magnum, and then some of these foramen you can also make out pretty well, and no obvious fracture. Everything looks pretty good. So this is a CT of the head. The indication was trauma. There is no acute intracranial abnormality, but there is a small right frontal scalp laceration. If you like the video, then click on the like button, and if you want to see more, then subscribe to the channel. If you have any questions or comments, I will try to get to them when I can. Thanks.